Hi, everybody. Today we're going to discuss a question that's often asked of me, and I have it here. It is how to help your addicted child, signs of drug use, and it's broken down into different components. The questions are, what are the signs of drug use in teens and adult children? Number 2, how do you help an addicted child? Number 3, if a parent's child needs treatment, what steps do you recommend they take? As always, I take the clinical evidence out there, the scientific evidence out there, I distill it into my clinical practice and the clinical use out there, and I try to pass it on to you. In this particular case, my area of particular expertise here is going to, for the most part, rely my clinical experience and try to give you a little bit of a different answer than what's given to you, but what I think are kernels and what's generally missed out there with this problem. So that being the case, also always remember, please, that I'm going to try to give general answers, and you can fit your particular situation into that answer. For example, the main question is how to help your addicted child, signs of drug use. I'm going to change that. How to help an addicted loved one, whether it's your child or someone else that you are intimately involved with, or a brother, a sister, a cousin, a classmate, and I think what are the signs of drug use in teens and adult children is a good way to start. And I think in general, what you have to look for and be conscientious of is changes in normal pattern and physical appearance. For example, and this doesn't have to be your child, this can be a loved one like a brother, a sister, a cousin, a dear friend, and maybe your girlfriend or boyfriend, but we want to talk about adult children, young children, or teenage children and young adults. In general, you really want to look for changes in normal patterns of behavior. Second, you want to look for changes in normal physical presentation. What do I mean by those? If the grades start to drop, and that's the first thing you notice, if you start to notice their work pattern and behavior and getting up on time starts to change, if their work performance changes, if you start to notice things that don't add up, like, hey, why are you late? And it just consistently happens. I always like to use this example. If 2 plus 2 is supposed to equal to 4, and you're used to it equaling to 4, and all of a sudden someone's telling you it's 5, it's not going to be 5. In any universe or reality, 2 plus 2 is going to add up to 4. And these changes, like I said, maybe grades drop off, maybe school performance drop off, maybe there's a change in the social environment that they usually engage in, like the group of friends start to change, or maybe there's unaccounted time that continuously goes missing and they have an excuse for, or maybe they get fired from a job and they've been a great worker. Maybe they're not coming down to dinner. Maybe they're spending a lot more time in their room than they used to. Maybe they're spending a lot more money than they used to. Maybe they're asking for a lot more money than they used to. Maybe the bank account is suddenly drained and there's no explanation and what they tell you doesn't add up. Maybe sometimes it's multiple factors that are occurring at the same time. Maybe there's a sudden break off of friends, grades are dropping, they're waking up late for school or work, or they're having changes in work. Number 2, you want to see changes in physical experience, physical presentation. Maybe their hygiene is changing. Maybe they seem more sleepy than usual, and it happens consistently over and over again. Maybe you have things missing in the house, like your wallet, your money, a credit card. The excuses just don't add up. Maybe all of a sudden there's a whole bunch of money spent on a credit card, and an excuse is like, I had to get gas, and it shows up on the gas card. But maybe you have no idea the extent a drug user will go to meet their demands and their needs. They might buy a guy gas and change it for heroin. So in general, all of the things are not adding up. More important than that, here's what I see happening. There is a denial for a lot longer than there should be. And I think what I'm trying to say here is immediately when you start to see these changes, there has to be a degree of vigilance. You have to assume the worst, not necessarily act on it, not necessarily react, but when there's changes in our surrounding that are not accounted for by the normal, regular pattern routine of things, you are going to have to consider the worst alternative. Let me give an example in a cheating spouse. Oftentimes, it's a very, very tragic thing. It's a very shocking thing. It's a very painful thing. And it's the kind of things that emotionally we don't want to accept, even when the reality is right in front of us. This sort of a cognitive dissonance. Reality is not adding up to what your belief system is, and you're not going to accept reality. So you almost lie to yourself about things that you may see. A spouse may be late all the time when they usually come home from work. They're more distant and detached. Maybe they're dressing up more and better than they usually do, and it doesn't add up. Maybe they have more meetings for work than they usually do, or meeting their friends. And oftentimes in these situations that are very difficult to accept, we seem to disengage from what's right in front of us, and someone else would notice and not notice it for a very long time, and this could be a deadly thing. Now, on the other side of this question, I also want to warn, well, don't become hyper vigilant and paranoid when things aren't adding up. Could be a lot of different things. Could be anxiety. It could be depression. It could be going through a breakup that they don't want you to know about. It could be sexual issues. It could be bullying. All kinds of things could be happening, but nevertheless, keep in the back of your mind that this kind of thing, if you miss, can be a deadly thing to miss. And the longer you wait, the harder it becomes to deal with. So I think to a great extent that answers our first part of our questions. Let's kind of move on here to the second part, which asks, how do you help an addicted child? And I want to also add question number 3 in there. If a parent-child needs treatment, what steps do you recommend they take? Which to me, those are sort of the same question. How do you help an addicted child? If a parent-child needs treatment, what steps do you recommend they take? For you to take steps, you're going to have to understand how to help them. And to understand that, you have to understand what it is what you're dealing with. I'm going to answer this question. Again, there's always caveats. There's always differences. There's always particular situations. But the thing that I see happening mostly from the root of this issue when parents or loved ones try to get involved to help is a complete misunderstanding of what it is they're dealing with and what needs to be done. Part of that is the earlier discussion we had about what it is to have cognitive dissonance, not really accepting the gravity and the seriousness of the situation and what you're dealing with. And B, when you do reach out for help, I personally feel, and this is my opinion, that there's so much misinformation out there, such a misunderstanding about substance abuse and what drug addiction is. And then on top of that, that information is being given by where you're looking up to get help and the people you're reaching out to, for example, from my side. And then C, there's so much money involved in this industry. There's a $40 billion a year in industry. There's a lot of incentive from folks on my side to get you under their care, especially when you're talking about detox, residential, and outpatient psychosocial services. There's such an incentive to get you into the program, and the folks trying to sell you this cure or this treatment themselves oftentimes, sometimes well-intentioned, sometimes not, have such a misunderstanding and archaic view of what substance abuse and addiction is. And the clinicians and professionals really there to help you may not have enough credentials to deal with a very complex, serious issue. So my first advice to parents and loved ones is really understand what substance abuse and addiction is. And I can give you a little bit about it. This is not usually, again, there's times when this is not the case. You have to look at each case for what it is. Usually, this is a very long issue to deal with. It is a chronic issue to deal with. There's not a quick fix. And oftentimes, there's so many underlying factors, whether it's childhood trauma, childhood abuse, emotional issues, sexuality issues. There's so much underneath this that you have to really ask yourself, because the truth of the matter is, this particular issue, addiction and substance abuse, is nothing more in a lot of ways than a manifestation of a deeper underlying issue. So after you even deal with the drug issue, you still have to deal with the underlying issue to really get at the root of this. And the drug issue itself may by that time be so severe that if someone tries to sell you on a 30-day, 10-day, 60-day, even a year treatment, sometimes they're shooting overboard. The patient does not need that kind of care. Oftentimes, they're shooting under, and the patient needs a lot more care than you think. Maybe not that intensity of care. Maybe they need something very intense for the first 10 days, for the first 1 month, for the first 2 to 3 months, and then afterwards it could be really leveled off. Please get a real understanding of what substance abuse is, where they are at in their degree of abuse, and what sort of long-term care or engagement with the professional they need. And I'm giving you so much here, and you're like, well, where do I get that information? And I think you're going to have to go to the professional organizations. If you don't have a physician that you really trust, I want to shy away from that. You might trust someone and they're well-intentioned, but understanding what this thing is and the kind of care that's needed and the intensity of care that's needed at what stage in time and how to increase that intensity and decrease that intensity, that takes a lot of expertise. There's no one cookie cutter way to approach this. And I'm almost at a loss to what advice to give, except maybe go to SAMHSA, maybe go to World Health Organization literature on this, go to the ruling bodies, go to American Society of Addiction Medicine, and start really understanding what this issue is. Because if you don't, you're gonna do a few things. Oftentimes, not always, this really should be looked at as a family disease, and it has a profound impact on the family. One of the areas it's going to have a major impact on is your pocketbook. And if you shoot your load, so to say, right off the bat, early on, extensively, and think you're going to get the desired result, oftentimes you're in for a large disappointment. And pretty soon, you're going to be running on empty emotionally, psychologically, physically, financially, in your own relationship with your other loved ones, and professionally in whatever work you're trying to do. And the best way to do this is understand what addiction is, see where your loved one is placed in that kind of paradigm and conceptual framework, reach out to a real professional that understands this and approaches this with ethics outside of just charging you for a quick treatment and send you home and everything is going to be okay, and then approach it in that way. So for example, let's compare it to another disease process. Let's compare it to diabetes, or let's compare it to cancer. You don't just get type 1 diabetes, which is a childhood onset usually, and come and say, you have diabetes, give me this much money and it's done. You have to really understand what this disease is, what the medication management is, and what the long-term management is. And over time, that management should get easier, so it makes the disease progression slower and actually tries to bring your sugar levels to a halt of where it's at, and you manage that appropriately. This is no different. You have to truly understand what the disease is, where your loved one is at the disease, what it's going to cost you in the short term and long term in terms of financial, emotional, psychological, your own physical health and time, your relationship with others, and approach it in a really educated, sober-minded fashion. And the place to look or start off with is finding a true professional that understands what this issue is and educates you, and understand there's going to be ups and downs, oftentimes, not always. And a good place to start maybe is some of the professional literature, SAMHSA, American Society of Addiction Medicine, World Health Organization, and really understand what this disease is. This is a very large topic, and I'm just giving you the tip of the iceberg, and I'm sorry for doing that. I want everyone to have a starting point before they go out and really spend everything they have in terms of all of those things and just be in for a disappointment and or a loved one gets sicker and dies. Please go ahead and click on the link above for our other videos on this channel that educate on substance abuse. Otherwise, if you find this information helpful, please subscribe to our channel by clicking the link before and pressing the bell for further notifications. Have a wonderful day.